United Arab Emirates has a relatively young healthcare system. When the country was established just over 40 years ago, there were only 7 hospitals and 200 doctors. Now it's attracting some big international names like the Cleveland Clinic and Imperial College to set up shop here, as Shamsheer Vayalil found out.
In the shiny capital of the United Arab Emirates, patients at this hospital are greeted by a concierge. Open less than a year, Burjeel is Abu Dhabi's newest and largest private hospital, part of an ongoing shift towards privatizing the health sector in this oil-rich country.
Before it was mostly public, but now if you see the outpatients already has shifted. Now I think 70% of the outpatients are seen by private. Here we can take decisions much faster. The quality of care, we focus on that. So I think private will have a bigger role to play in the years to come.
For expertise, they've looked abroad.
We brought centers of excellences into the hospital. So the concept was we provide the core infrastructure and then bring in clinical centers who are good in providing the care.
They've partnered with Columbia University for the cardiac department, Brussels University for IVF, and King's College London for fetal medicine. It's a reflection of the wider strategy of the United Arab Emirates to shift from public healthcare facilities to fully private or public-private partnerships. Investment in the health sector is expected to exceed $3.2 billion this year in Abu Dhabi alone. Part of the strategy is banking on international brand names, like the Imperial College London, Johns Hopkins, and the Cleveland Clinic. In neighboring Dubai, almost 3/4 of medical facilities are already private. The head of Dubai's health authority says the key is for government to strike the right balance between being a regulator and a provider.
Efficiency goes wherever there is, equilibrium. So the government should concentrate on the legislation and control of the market and the industry and the service, and leave the private to do and provide the service.
A service that includes, in true Dubai style, a drive to become a regional medical tourism hub, anchored in the 4.1 million square foot Dubai healthcare city.
We are planning for the medical tourism, which is coming up. Dubai has a lot of infrastructure in so many fields, so we are adding just another service to that, and it's growing up, and the participation by the private mainly will be by the private in that sector.
But a countrywide shortage of medical staff is slowing these ambitious plans down. One fundamental challenge is that the overwhelming majority of the workforce in the UAE is expatriate and therefore transient. So sustaining a vibrant health sector depends on encouraging more Emiratis to study and practice medicine at home. Burjeel, like many private hospitals, is launching a training program for postgraduate Emiratis.
We need to attract more people to get into the postgraduate training and to make them focus on certain specialities which the country needs. So I think that's going to be the next challenge that we face.
A challenge that will be felt more acutely as this hospital launches a $240 million expansion, twice the size of its current facility, requiring 1,200 more medical staff. But the big question will perhaps be, is bigger necessarily better? Shamsheer Vayalil for Marketplace Middle East, Abu Dhabi.
Pushing privatization here in the UAE and other countries. And that's it for this edition of CNN Marketplace Middle East. I'm John Defterius. Thanks for watching. We'll see you next week.